minutes right now past 8 o'clock. It's time now for Common Sense Matters, a show that's being presented by the Franklin County Democratic Party here on WCDT. And they have asked Dr. Lynn Williams to come in and talk a little bit about the COVID-19. And we'll say good morning to Dr. Lynn. Hi, good morning.
Good morning. How are you?
I'm doing fine in this isolated world that we're in. I guess I'm doing fairly well.
Yeah.
So how are you doing?
I'm good. I'm actually on vacation this week. We had already planned to do some camping, and that got canceled in Cloudland Canyon in Georgia. So just kind of hanging out at home and working on the house and working on the yard and trying to stay in place a little bit, being cautious. So a couple of things have changed with my life a little bit. Of course, I'm a family physician in Winchester, have been for 30 years. I was in Deckard for several years, and then now in the last 3 years, after a cancer diagnosis, I've been moved to First Choice Health and work for AMG, which is kind of associated with Life Point Hospitals. In the last 3 weeks, in order to keep seeing patients, they kind of divided my practice out to an office in the hospital or beside the hospital. And we've been seeing well patients there. And we're gearing up also to do more telehealth to keep people safer. We've done some telephone checks and kind of checking on folks at home and doing a little bit of, making sure people have their medicines and things like that. So, yeah, things are definitely different.
That's kind of interesting. The telechecks and things like that. It's kind of like, how do you really work with somebody over the phone? But I guess you can.
Well, it's something that I have done as a family physician for a long time. As far as returning calls, as far as does somebody need to be seen? Do they need to go to the emergency room? Even over my career, you have to make those kind of decisions. And frankly, in the heyday of my practice, we probably had 50 to 75 phone calls a day related to refills or, do I need to come in, or I've got this problem, or what have you. So the telehealth will be a little bit different. It's more of maybe a more organized sort of a thing that somebody has a specific problem and requests it. And so hopefully we'll get that geared up when I get back to the office after Easter.
So do you think that maybe medicine is changing a little bit as far as how we want to see patients and the need? Do you see some kind of change in healthcare after all this? There's
it seems to change every day, doesn't it? And maybe I've seen a lot of ads on TV since I've been at home this week that call in for your birth control pills, or call. You don't even have to go to the doctor. You don't have to go to the pharmacy. They'll mail it to you and stuff like that. But you have to understand medicine. There's a limit to what we can do over the phone, and if say, for example, the birth control pills, if somebody, you have to make sure that blood pressure's okay. You may have to make sure that they're not pregnant. There's a lot of different things involved with that. So I think that's a pretty limited sort of a thing to do over the phone or, through a video with a patient or something like that. And, on that same or on a similar vein, I guess, I see ads as well for ED you don't have to come in to get your prescription. You just call this number. But there's also some newer ones that say, darn, this means there may be a problem and you need to have further investigation, that kind of thing. So we have limited amount of things that we can do over the phone. You can't have blood work drawn. You can't have a pap smear. You can't have a chest X-ray. There's some limitations for sure. But I think there are situations where if somebody's homebound or what have you, that may make it a little bit easier to see folks, or if somebody's contagious, to make sure that they're taken care of at home as well. So we'll see.
Right. Well, those kind of things scare me.
Yeah.
Because how do you know you're dealing with a reputable person when you call?
Exactly. I mean, I have track record of being here for 30 years. People know what to expect from me, and so who is that person? Is it somebody that's on the fringe that lost their license, or cagey somebody? Who
Right.
knows? It's something to be aware of. I think it's always better to have somebody that knows you taking care of you. I've had folks through the years that I've seen for all that 30-year period of time. I have babies that have had babies, that kind of situation. And I know if they're sick or hurting or
Right.
what have you, I know when I know what to expect with that. And I trust those people to tell me the truth, or, what they feel that's the truth that's going on with them too. So, but I think that is important. Yeah. And that's maybe a little plug for your family doctor, family practitioner. We're the ones that do know you and have taken care of you through thick and thin and what have you. So, and I hope I have that, and I know I have that trust with most of my patients. There's some new ones that haven't got to know me too well, but we'll make that work.
I remember when you opened up your practice.
Mm-hmm.
I remember that, and you were the new doctor on the scene.
Oh yeah,
I remember that.
When we first moved in, and I actually had a guarantee with the hospital. I didn't think I was coming back here. I had gone away to school and to residency, and I was going to stay in Pennsylvania. I was in Erie, Pennsylvania, doing training, and it came down to do some work with Dr. Smith, Tommy Smith, and he introduced me to, and I can't even think of the guy's name that was administrator then, but he introduced me to the administrator, and they had a contract going, and said, "We need you here." So, and I never looked back, and I never regretted it.
Right, that's pretty cool. All right, there was some talk this morning about allowing people to go back to work, but they're saying that there's things that you need to do every morning, like check your temperature and things like that, and see if there's changes. Is that something we need to be doing if we're going to work or not going to work?
Well, I've not heard that as far as a recommendation. I did listen to Dr. Fauci this morning on the Today Show a little while ago, and he said, it's still very important to continue to be careful, and that certainly mitigations help to make a difference, but physical separation is still very, very important at this point. We're and as far as Tennessee, we're not even to our peak yet. We're considered to be at our peak on the 17th for resource use. So that's I think we and it's not my job to make those decisions, but it's certainly my job to make my opinion heard. I think it's still very important to be very, very careful, and I think that means people staying at home, especially people that are elderly and actually people my age and your age, Al, that we aren't so elderly and don't consider ourselves elderly, but we have a higher risk for sure.
Right.
And people that have previous complicated diseases, that it's very important for us to still be very careful as far as physical distance with other folks. And, that's another thing Dr. Fauci said, that he felt that we were doing a really good job. I took my trash before the trash places closed yesterday, and there was a lot of folks out, a lot of folks on the road, and hopefully they were being careful. But I know there's a lot of folks that are really anxious to work and get back to work, and I certainly am lucky to be able to continue to work. But I know that's really frustrating for a lot of folks. I have a niece in Murfreesboro that is a cosmetologist, and their income was essentially cut in half because of having to stay in place. Her husband is an SRO at one of the schools, and he's still able to be employed and kind of on call, but still that's kind of a worry, and it's worrisome to them that they may lose that income too. So, and I know there's plenty of people in Franklin County that have the same
Right.
issues too. I've talked to them in the office. I've seen some work-related injuries in the office in the last couple of weeks, and some of the smaller factories were still working at that time. But I think it's still very, very important for us to be careful. Now, talking about temperature, though, Al, since my office has temporarily moved over to the office building at the hospital, of course, has their emergency operations plan into place and has had I think they've had that in place. I can't remember now. I had that data written down, but their emergency operations plan is in place, and we have our temperatures checked every time, and every patient that goes into that office building has their temperature checked. If someone has a temperature, they're not allowed to go in the office. We have been wearing masks at least for the last 2 or 3 weeks, also throughout the hospital.
So do you feel like that as an individual, that's something that we need to monitor, because that is one of the telltale signs?
Yeah, and that's in flux too. Some people have not had temperatures, but that's a telltale sign of having the disease show itself. But they feel that there's several days of infectivity, while even before someone has a fever, even before someone has a dry cough, even before someone has some of these other diseases like symptoms like shortness of breath, and there's some actually vomiting and diarrhea that they're seeing in a few folks too. So temperatures maybe not the 100% helpful as far as transmissibility. And there's a lot of controversy. Should we be wearing masks? They think that it's helpful if somehow I am, just too early to tell that I have the disease, that it may prevent me from infecting somebody else. So I've been wearing a mask as soon as the hospital recommended a mask at work. I've been wearing it when I go to the grocery store or when I go out around folks too. So it's the same mask, but it dries out in the car, and it hasn't started smelling yet, so I think I'm okay. But
can you disinfect those? Is there a way to disinfect those?
With the regular surgical masks, I'm not sure. I think just kind of letting it stay in the car in between my car trips is probably the best thing I can do. I know that at First Choice Health they're doing some type of disinfectant process as far as maybe an autoclave or something like that. Now I just have heard somebody say that, but the paper masks are expected and supposed to be discarded, after you've finished your surgery or finished your case or something like
right.
Finished case or something like that. So, like I said, I think it's just kind of being on the careful side. And I'm not on the front lines, and I'm certainly lucky with that. But so I would keep anything that was, like the N95s or anything more isolating or protective, I guess. Keep those for the people on the front lines.
All right. What about gloves? People are wearing gloves a lot. I was told, I read an article that maybe that's worse than using your hands because of the transfer ratio.
Well, I didn't wear gloves until the last trip to the grocery store. They happened to have some sitting there, so I decided if I was going to touch my bananas or tomatoes or whatever, that maybe that was a good thing. I discarded them. I still used the hand sanitizer immediately after taking those off. And of course, I've seen pictures of people tossing them in the grocery store parking lot. That's not good at all. But discarded them as soon as I got home. But and hand washing is like the most important thing. We've done some Zoom meetings for church and Rotary and Bible study at church and what have you. And you have your little picture up where you can see your image, and it's incredible how many times, if I take a look at my picture, how many times I touch my face. It's just normal. You're scratching something or just holding your hands and on your face to ponder something, and it's just incredible how many times we do touch our face. Now, I will tell you, we have gone through sanitizer and soap at home like we never have before. It's kind of like, wow, how did we use all that soap in the last week?
Right.
But we're just trying to be more careful, and I think that's what the recommendations are. Just wash the hands and keep your distance.
Right.
That's the most important thing. So back to the question about gloves. I think as long as you use them for the purpose, take them off, make sure you sanitize your hands, and then wash your hands as soon as possible. I think that's the recommendation I would say.
Okay. I just know they said that the germs maybe hang on the gloves longer than they do your hands. So, continue to use it. I think you're right, because it's theoretically you should dispose of them right after you use them, and not keep wearing them and doing multiple things with them.
Right, because you're going to touch your face with your gloved hands too. Now, you actually can sanitize your hands with the gloves on too, which may make you a little bit more careful, in between times taking your gloves off, or sanitize them before you take them off to make sure you're not transferring any germs to your hands. And as far as how we're taught to disrobe, our PPE, it's really important to kind of peel those gloves off into themselves, so you're actually what you're throwing away is like a little ball of inside-out gloves.
Yep.
So that's really, really important. Now, if we're talking about you've got a couple of surgical gloves at home, or you've got your your Playtex gloves that you're wearing out, like I said, that would be really important to make sure you wash them before you take them off, and then wash your hands after you take them off. Wash or use alcohol, an alcohol gel on the outside and then on your hands when you take them off.
And there's an art to taking gloves off. You're listening to Common Sense Matters, brought to you by the Franklin County Democratic Party. Here at WCDT, we're talking with Dr. Lynn Williams. It's 8:24. We got about 6 minutes left. Is there anything new out there that people need to know about the virus?
A couple of things that I had jotted down listening to Dr. Fauci this morning. He said one thing that we're probably under-reporting deaths. There was some information out there that maybe we might be over-reporting, that people were dying of heart attacks or something like that, but he felt like that we were under-reporting deaths. He also was talking about the antibody tests. And they're not, there's some that have been approved and thought they would be out very soon. And he said that was very important to tell who has had the disease, and he felt like they would be likely to be protected and able to get back into society. So that's really, really important. I think the biggest thing is being prepared, too. This is kind of a doctor's, especially an infectious disease doctor's, worst nightmare, that something that can spread this quickly throughout the world. And now it's happened. It's happened, other cases, of course, namely the influenza epidemic of 1918. But it's happened now even more quickly than that all happened, and it can happen again. So being prepared, I think, is the most important thing. Making sure our resources are directed towards preparedness. And, our local, our TEMA, our state FEMA, all those different organizations have, really diverse training in order for emergency preparedness, and they're spot on. They're ready, and they. One thing when hearing the Cliff Wilson from the hospital talk at Rotary the other day, our hospital, Southern Tennessee Regional Health System, is prepared as well as possible right now, and we have a real strong emergency operations plan. And our medical staff task force is also available and very prepared for the clinical side. So I guess we have some kind of glimmers of hope coming, and I know it's hard to be patient because it's been a really strange situation right now, but being patient, not jumping the gun, not jumping out and, assuming life is going to be back to normal, in a couple of weeks or something.
Right.
But being ready and being prepared.
Well, we had a person call, and I did see a story on this one about once you go to the grocery store or wherever you go, bringing that home and sanitizing and washing your veggies and your boxes and things that you get when you go to the grocery store or wherever you go. Is that something that needs to be done?
There's a lot of different discussion about that. But, if you can set things aside for a few days, that generally is going to take care of things. I think it's always important to wash fruit as well as you can, because you don't know who's touched it. And I think there's a lot of information out there on how to do it. I think it's pretty important not to put something on your fruit that's going to hurt you. Like Lysol. Don't put Lysol. Don't put alcohol on your fruit. And consider being careful about any kind of soapy sort of substance. There are some. I think soap and water. I think just running under water is really important. We usually have a little brush beside our sink to kind of wash things off too. In the last few days, I don't know how important this is, but in the last few days, I kind of grabbed the mail out of the box with the plastic bag and lay it out for the day and, open it up tomorrow sort of thing. So
Okay.
I think the bottom line is staying away from folks, especially big groups. And I think it's also super important to just keep those hands washed.
All right. Helen Stapleton's on the phone. I'm going to add her in real quick, okay?
Sure. Hi, Helen.
Hang on. All right, Helen, you're on.
Hey, thank you so much for doing this show and getting some good fact-based information out there. I was just wondering, and you may have already mentioned this, I didn't catch the entire show, but where can people get tested in Franklin County if they think they might? I know you can't in Sewanee. There's no test here, but is there a place where you can go in the county and get a corona test?
Frankly, no. There are places that can test, but they're still very, very restricted.
Not even the health department? I thought I'd heard the health department.
I don't think so. It still has not just by request. The places that are testing have to meet certain criteria, and their criteria have to do with symptoms. There are places that are testing, but as far as just walking in and being tested, no, there's not a place to do that. Even the places in Nashville that are the drive-through places have to have basically kind of like an order to do that, a prescription sort of from your doctor or from somebody that medical person to have that done. But there's no testing on demand at this point.
Right.
Okay, but if you were having all the classic symptoms, then you can get a test?
It goes through a protocol. I know that our nurses at First Choice Health, if they have, if somebody has the symptoms, and even if they, may have had some exposure, they actually are talking to the state health department, different other places, kind of to run it by them too. So they're still very restricted. The hospital and some of the clinics are still very restricted as how many tests they have, and that's something that really I think every physician I think a lot of physicians in the country really feel that that's important to test as much as possible and as many people as possible to find out who might be even an early infection. I think it's really pretty important to do, and we're still not there. I know we're testing a lot more than we were, and I don't know those numbers, but I know we're testing tremendous amount more than we were, but I think it would be better if we knew where positives were and how we could track them and make sure that people were safer.
Right. All right, guys, we're out of time. I've got another person I got to talk with this morning. Great information, I think, and I want to thank Helen, the Franklin County Democratic Party, for sponsoring this show and having Dr. Lynn Williams on the air.
Thanks, Al.
Thank you. Have a good day.
All right. You too.
Bye. All right, and we're going to change gears here just for half a second. Give me a half a second, and I got to stop something and start something.